Hi, my name is Rachel Cower, and today I'll be doing my presentation on Hirschsprung's disease. Everyone knows there are numerous diseases that we're not even aware of. In the world today, there are so many different diseases or sicknesses that we have to be cautious and on the lookout for so much. Hirschsprung's is a disease that's not very common. Today I'll be discussing Hirschsprung's disease, how it affects its patients, and what it is. Research shows the causes and the frequency of the disease, as well as the many symptoms and probability of developing the condition. The physician determines the treatment based on the severity of the disease. There are three common operations for Hirschsprung's: the Swenson, the swab, and the Duno operations. There are many elements in order to have success after surgery for Hirschsprung's disease. After much research has been done, it shows the main elements for long-term improvement are surgery and change of lifestyle. We will talk about understanding the facts of the disease and what some of the best treatments are for lifelong success with Hirschsprung's disease. Hirschsprung's disease is a disease of the large intestine, and I have a diagram of the human body of the digestive system. This is the large intestines, which is also the colon. This is the small intestines, and this is the rectum. This is what all Hirschsprung's disease affects. It affects the nerve cells in the large intestines called the ganglion cells. These are needed in order to make the muscles push. If these cells are not present to pass along stool, it could cause constipation. If this is not detected in time, the patient could have stool block in the large intestines. This could result in infection, rupturing of the colon, or even death. So Hirschsprung's disease is a disease of the large intestines absent the ganglion cells to produce stool. There are many different symptoms with Hirschsprung's disease. Some symptoms may be detected right away, while in some cases it could take years. But each individual with Hirschsprung's disease may show his or her symptoms differently. Majority of patients with the disease show their symptoms within the first 6 weeks, while other patients with short segment of the intestines is affected may not show any symptoms for months or even years. Some of the most common symptoms for Hirschsprung's in newborns are not having their first bowel movement, vomiting green bile, swelling of the abdomen, severe irritability, and fever. Some of the most common symptoms for children who did not show early symptoms are constipation that worsens, loss of appetite, physical and mental development is slower, and diarrhea. Sometimes when diarrhea is a symptom, a child could pass blood in their stool. In this case, they could become anemic. They would look very pale and they would become very tired. Not every case of Hirschsprung's disease is the same, so a child could have all of these symptoms or just some of them. Depending on the severity of the disease will determine the treatment. The physician will have to take in consideration the extent of the problem. In most cases, the surgery is treatment for Hirschsprung's disease. So the child's age, health, and medical history plays a big part in choosing the right path. There are 3 common surgeries performed with Hirschsprung's disease: the Swenson, the swab, and the Duno operations. Surgery is usually the only way to help the intestinal obstruction caused by Hirschsprung's. The first common surgery is the Swenson operation. This operation's main goal is to remove the defective cells that make it difficult to pass the stool. In this procedure, the physician will have to dissect the anal canal and perform an anal stomosis. An anal stomosis is a procedure to take the hollow organs and make a continuous connection between the two. According to Ovar Swenson in the Pediatrics Journal, the parts that are defective will be removed, and from there they will be made a connection in the intestines. Therefore, the anal canal is left in the right position. The second surgery is the swab operation. According to Li I Wu of the Chinese Medical Journal, the procedure is performed by making an incision around the perimeter of the muscular coat of the colon. The defective cells in the perimeter are then separated. After the cells are removed, the colon is pulled through and retains its position. In this procedure, the telescoping anastomosis is done to add an additional layer of the colon. The third surgery is the Duno operation. Like the other operations, this main goal is to remove the defective cells. According to James Talbot of the Annals of Surgery Journal, the physician will modify the pull-through by using a longitudinal anastomosis. This incision is made lengthways to remove the cells. Due to the cut, the resection of the anal will be side to side instead of end to end. In conclusion, Hirschsprung's disease is a very rare and serious disease. I have discussed the disease and how it affects its patients. There are many symptoms of Hirschsprung's disease, but the most common is constipation. In most cases, surgery is the treatment for Hirschsprung's disease. The three most common surgeries are the Swenson, the swab, and the duodenal operations. But after much research has been done, it shows the main elements for long-term improvement are surgery and change of lifestyle. Are there any questions?
What causes Hirschsprung's disease?
In most cases, they say it's hereditary. This means that the mother or father could carry the disease and pass it along to their child. Or they could have a child already with the disease, and it's good chances they'll have another one with the disease as well.
How often does Hirschsprung's disease occur?
It affects every 1 out of 5,000 live births, and it's more common in males to females 5 to 1. Thank you.